We are entering the time of year that typically marks the start of cold and flu season. Research shows that getting the flu vaccine can reduce influenza illnesses by 40 to 60%. And if you get the vaccine sooner, you can help us avoid a strain on our health system. Let's learn more from one of our talented Intermountain Health physicians.
Hi, I am Janice Fordham. I'm a family medicine physician. I practice in Laurel, and I'm really excited to talk to you today about the flu vaccine. You should talk to your primary care provider about what's best for you and your health. However, most people should get their flu vaccine because the virus is constantly changing, and every year we need to predict what we think the circulating strains are going to be. Flu vaccines are composed of inactivated strains of the virus, and they change annually. You should get the flu vaccine every year because we do think it tapers off somewhere around 6 months. However, the flu vaccine should last the entire season, but this is the reason that we recommend getting one annually. We typically suggest getting the flu shot in early fall before the end of October. However, if you did not get your flu shot before the end of October, I still recommend getting one as the flu can last through early spring. It takes a few weeks to be fully protected, so we recommend about 2 weeks to be fully immunized. It's hard to predict when the flu season will peak, and we usually have a few peaks during the season, so sometimes in the fall and spring, so it's best to get it and be protected. I think that the flu shot is really important, and if you're able to get the flu vaccine, I think it's the right thing to do every year. Right now, we have circulating COVID as well, and so there's a big strain on the healthcare system if there's multiple illnesses, and so I think if you can get your vaccine, it's the right thing to do for you. Yes, you can get both your flu and your COVID vaccine at the same time. Studies have shown that it is effective and that we do mount a proper immune response. You may have some side effects if you've had them with the flu or the COVID vaccine. However, it is safe and effective if you want to get them at the same time. Yes, it is true that sometimes flu vaccines won't always work for everyone that gets vaccinated. And this has a lot to do with you and your immune response. However, even if you do get a flu vaccine, usually you likely get some immunity from that. So there is some protection just by getting your flu vaccine. Thanks for listening, and I hope this guidance was helpful.